Thank you, Sarah, for allowing me to examine your daughter's vitals. Based on the examination, the vitals are really satisfactory. However, I noticed a mild wheeze, which is a whistling sound when she breathes, but it is not so severe. So don't worry, there is no cause for any concerns. This condition can be effectively manageable. Before moving further, I would like to ask you a few questions to better understand your child's health condition. It would help us to gather some more information. May I proceed?
Okay, nurse. Please proceed.
How long has she been experiencing this condition?
She has been experiencing this condition for the last 2 weeks.
Do you know the potential triggers behind these symptoms?
No, nurse. I don't have any idea.
Did you notice any changes in their severity?
No, nurse. I have never noticed anything.
Have you given her any treatments?
No, nurse. I have not given her any treatments.
Could you tell me whether your child has experienced similar symptoms in the past?
No, nurse. She has never experienced it before.
Does she have any family history of asthma, hay fever, eczema, or other allergic conditions?
No, nurse. As far as I know, we do not have any family history of asthma, hay fever, eczema, or any other allergic conditions.
Thank you, Sarah, for sharing those valuable information with me. Now let me explain to you the next step. First of all, your daughter will be assessed by the doctor. This may include a physical examination to identify any visible signs or abnormalities. Depending on the findings, further investigations such as blood tests, imaging, or allergy tests might be commenced to confirm an initial diagnosis. Once a diagnosis is confirmed, the doctor will discuss potential treatment options with you. Are you following me, Sarah?
Sure, nurse. But can you confirm the exact diagnosis now?
Your worries are understandable, Sarah, but unfortunately, I'm not the authorized person to confirm the diagnosis because it's not my role. So, it is the role of the doctor. While the symptoms described may be consistent with conditions like asthma, diagnosing asthma is really difficult, especially in children or early stages, and it requires a detailed examination by the doctor. They may consider factors such as medical history, physical examination, and possibly diagnostics test to reach a conclusion. In the meantime, do you have any other questions or concerns?
Yes, nurse. Approximately how long should I wait here to meet the doctor?
I completely understand your concern, Sarah, but I want to reassure you that the waiting time shouldn't be too long. We are not very busy at the moment, and there are several doctors available, so your child is likely to be seen soon. Once the doctor assesses your child, it will be a quick examination, and if needed, they can start treatment right away, such as using a salbutamol inhaler to help with breathing. In the meantime, would it be okay for you to return to the waiting room?
Sure, nurse.
I appreciate your willingness to return to the waiting room, Sarah. Finally, do you have any questions or concern?
No, nurse. Thank you for your help. I can return to the waiting room now.
Thank you, Sarah. Now, let me recap what we have discussed until now. We have been discussing your daughter's condition, that is asthma, the symptoms, and the diagnosis along with treatments. I hope you understand that. Now, please return to the waiting room. I'm going to make an appointment with the doctor. In between, if you have any questions or concern, you can ask me. I would be glad to help you. Thank you, Sarah, for visiting our children's hospital. I wish your daughter a faster recovery. Thank you.